try-in step is a very important step that allows you to evaluate your denture while it is still in wax, so that any necessary adjustments can be corrected easily. First, you have to check your case on the articulator. You can check first the articulator itself, then the cusps, the trial denture bases, and the artificial teeth. Regarding the articulator, you have to check the tightening screws. It has to be firmly tightened. The mounting rings should be in its proper position and correctly screwed. The incisal pin should be in its correct position, and the trial denture bases in its proper position. The cast should be free from any waxes and from any scratches, and any undercuts should be blocked. Also, the trial denture bases should be free from any waxes, from any scratches. It should have also rounded edges. Any sharp edges shouldn't be present. The artificial teeth should be checked to be of the properly selected shade, size, and shape, and there shouldn't be any contact between the upper and lower anterior teeth unless an edge-to-edge contact is selected. Maximum intercuspation should be present between the posterior teeth as well. After that, regarding the lower arch, the central groove should be on the crest of the lower ridge to ensure stability of the lower denture, and the lower posterior teeth shouldn't be inclined lingually unless otherwise it will encroach on the tongue space, which may endanger the stability of the lower denture. Regarding the upper arch, the midline of the dental arch should coincide with the line drawn from the median palatine suture, the incisive papilla, and the labial frenum. Also, the labial surface of the central incisors should be 8 to 10 millimeter from the center of the incisive papilla. Thank you. Then you have to check the case inside the patient mouth. You have to check the upper trial denture base alone and the lower alone. Then you have to check both with each other. Regarding the upper trial denture base, I have to check the extension, retention, and stability first. The extension, all the extensions of the trial denture base should be reaching the functional depth and width of the vestibule, anteriorly and posteriorly. If the extension is not, if the upper trial denture base is underextended in the patient mouth, and it is already in its proper length on the cast as already checked, then the secondary impression has to be repeated. After checking the extension, unfortunately the retention cannot be accurately checked during the try-in stage, as it's not the final denture. Regarding the stability, alternate pressure can be applied on the premolar molar area. Alternate pressure can be applied on the premolar molar area. We can check the anterior retention by applying an pull force anteriorly. You can check the posterior retention by applying an upward force on the palatal surface of the anterior teeth, and you can check this side retention by applying an alternate pressure is applied on the premolar molar area to check the stability of the upper trial denture base. And insufficient relief of the median palatine brachy, then the trial denture will rot. It also can indicate that the upper posterior teeth on one side are outside the ridge. If applying a pressure on this side can cause this side to rise from the basal seat. After that, the occlusal plane should be checked. Regarding the lower trial denture base, also the extension and retention and stability should be checked also as the upper trial denture base. Then the occlusal plane should be checked to be below the maximum convexity of the tongue and below 2/3 the retromolar pad. To check this, ask your patient to relax his tongue behind the lingual surface of the lower anterior teeth. هيك ريح لسانك وخليه يبقى لامس الطقم من هنا. The lower occlusal plane should be below the maximum convexity of the tongue. Also, the lower posterior teeth shouldn't encroach on the tongue space. To test this, you have to ask your patient to raise his tongue slowly. هيك اقفل البقى، اقفل عليها، ابتدي ارفع لسانك بالراحة، ارفع لسانك بالراحة، كمان شوية، كمان شوية، كمان ارفع بالراحة. If the posterior teeth are encroaching on the tongue space, this will cause your denture to raise from its place. The both trial denture bases should be checked together. You have to check three things: the vertical relation, the centrical relation, and the even bearing. Regarding the vertical relation, you should ask your patient first to say M. هيك قول ميم كده وريح. The patient lips should touch lightly when he says if M. He should have a normal appearance without a stretched tight appearance or the senile appearance. هيك لمس سنانك قافل على. You can check the vertical dimension with any of the techniques used or the methods used during the the measuring of the vertical dimension of centric occluding relation. You can measure the vertical dimension of FREST. First, remove the lower trial denture base and measure the vertical dimension of FREST, and then remove 2 millimeters of the free space, and then put the lower trial denture base to measure the vertical dimension of occlusion. If it's correct, then the vertical relation is ideal. First, we have to check the vertical relation after putting the two trial denture bases together. They can be checked using the aesthetics of the patient. He has to have the normal appearance without the stretched tight appearance or the senile appearance. Also, it can be measured using any of the methods used for measuring the vertical dimension of centric occluding relation. By removing the lower trial denture base, the vertical dimension of FREST can be measured by marking 2 points. Then you can put the lower trial denture base to measure the vertical dimension of occlusion, which should be less 2 millimeters than the vertical dimension of FREST, which equals to the freeway space. which means when the patient is in the physiological rest position, there must be 2 millimeters between the posterior teeth. After that, we have to check the centric relation of the patient. هات لسانك سقف حلقك ورا وريح وقف معايا. The centric relation should coincide with the centric occlusion of the patient. If incorrect centric relation, if it is minor, it can be corrected. If it is major, the lower posterior teeth should be removed and rebite should be taken again, and remounting and another try-in should be made. After checking the centric relation, uneven bearing should be checked. There are 4 methods to check the even bearing. There are 4 methods to check the uneven bearing. First, you can use celluloid strap, which can be placed at the same time between on each side of the dental arches. And equal pulling forces means equal occlusal pressure. Another method is to ask the patient to close in the centric and then try to push the upper denture using your thumb and the lower denture using your index finger to the lower, pushing it down. If no separation occurs, then there is an equal occlusal pressure. Another method is to ask your patient to open his mouth and then to close to the first contact. You have to check to notice if the first contact happened at the same time or not, and to check if the denture, the trial denture, rised from its basal seat while closing or not. The last thing to do is to check the aesthetics and phonetics. هيك ممكن تقول عد من 60 ل 70.
60 61 62 63 64 65 66.
During the pronunciation of the S sound, you can check the closest speaking space. You can check the horizontal overjet. If the patient says TH instead of S, this means that there is insufficient horizontal overlap, or the upper anterior, the upper palatal portion is too thick. This has to be corrected. Also, if there is whistling during the pronunciation of the S sound, this means that there is increased horizontal overjet, which should be corrected also. We can also check the letter F. حياتك قول ف. During the pronunciation of the F, تاني بعد إذنك. خليك قايل. The incisal edges should touch the dry and the moist surface of the lower lip. After that, we can check the aesthetics of the patient. The vermilion border should be visible. The nasolabial sulcus should be not distorted. The philtrum also should be not distorted. The corners of the mouth should be also supported. The smile line. The fourth method to check the even bearing is to insert a knife at the premolar molar area where the patient is biting in the centric occlusion. If the knife can be inserted, this indicates a gross discrepancy in the occlusal pressure, and at this time the centric relation has to be repeated. After that, ask your patient to smile. The shape and shade and size of your teeth should be checked. Regarding the shade, it should be conform with the patient age. For old age, we can choose darker teeth. It should also conform with the shade of the skin and the eye and the hair as well. The size of the teeth, the mesiolabial aspect of the canine should be visible from the front aspect of your patient, and the tip of the canine, the tip of the canine should be with the corners of the mouth. The shape of the teeth should also conform with the shape of the patient. If your patient has a rounded face, you have to choose rounded teeth. If he has long, narrow face, you can choose long, narrow teeth.